Dr. Huffaker, I wanted to ask you a few questions about a breast lift. How does a woman know that she needs a breast lift?
Generally, if your nipple is lower than the breast crease, you very likely will need a breast lift.
Okay, so is there more than one type of breast lift, and how do I know which one I would need?
Yes, there are different types, and basically it depends upon how low you start out and how high you want to finish. Everyone is different. Some women want a more natural look, some women want a higher look.
Okay.
The higher you want to look, the more it's going to take to get there. Sometimes we can, if someone has just a little bit of laxity in their breast, we can do it with a simple breast implant. If someone has just a little bit of droop down, we can do what we call an ellipse mastopexy, ellipse lift. It's like taking a little crescent skin out above the areola, maybe inch to 2 inches wide. It basically it's not really a true breast lift. It raises the nipple or areolar complex, and it just helps to centralize the nipple or areola. If somebody needs a little bit more than that, we can do what we call a circumareolar lift. It's just where we go all the way around the areola. We take out a donut segment of skin and then bring it together. So we're tightening up a little bit of the breast at the same time. If beyond that, it goes to a vertical lift where we end up with incision around the areola and one straight down from the areola to the crease. Some people call it the lollipop incision. Sometimes a little tiny short incision in the crease, a couple inches long. It's not a big long slash from one side to the other, but we can lift most women's breasts that way.
So how much lift can you get with a breast lift?
You can get quite a bit. I mean, it just been, you can get, there's an ideal placement for the nipple, and we go up to the ideal placement for the nipple, and so you can, it depends upon how low your nipple and everything is, then we get it up to the right place. So you don't want to get it up to your clavicles. You don't want to go too high. I mean, throw it over your shoulder or anything like that.
So is it common to lose volume with a lift?
Well, what happens is with the vertical lifts I had mentioned, the tissue is being compacted. We're pushing the tissue together a little bit so that it is squeezed together. When we do that, when we compact it, it makes the breast look a little bit smaller because we're squishing everything together. So that typically you might drop a cup size when we do that. We don't do that with either the ellipse or the circumareolar. It's only when we do the vertical. And we can do the vertical without an implant. Most of the time we will use an implant with that for more volume, because a lot of times women, when they've lost volume, they've lost more than what we can establish just by compacting this tissue itself. We need to add a little implant for a little bit more oomph.
So after a lift, do most women go back to their pre-pregnancy size if they've nursed children?
Usually beyond their pre-pregnancy size. Most women want to be a little larger than they were pre-pregnancy. Some women come in and say, I just want to be where I was. When they go through the sizing that we talked about earlier, they end up going a little bit larger than they once were. The upper limits of where most women want to be is they don't want to be in a real noticeable state. A lot of our women want to be large enough that they can still look sexy, but small enough that they can still look conservative if they want to look professional. So that, if you get too large, you're always out there and making a statement. Most women want to be in that zone where they can go either way.
So as you mentioned, having the augmentation with the lift, can you do that at the same time? Is that the same procedure, or do you use it 2 separate surgeries?
No, it's some people like to do it 2 separate times. There's certainly some judgment goes into that when we do a breast lift plus an augment, but I do them all at the same time. I prefer it that way. I think it's easier. there's only one healing period, so it just makes it a lot easier for people to go through. Nobody wants to go through 2 surgeries to get something done.
So how long is the procedure? Is it outpatient?
Well, the ellipse that I talked about, the simplest one, takes about 2 hours with an implant. If we do that, and sometimes we will do that without an implant, it probably takes an hour. If we do a circumwheeler lift, you're probably looking at about 2 hours and a half. Same way with a vertical mastopexy, we'll do it in about 2 hours and a half.
So what's the recovery like?
Recovery's pretty easy, actually. The lift itself probably does not add anything on to the augmentation. It's more like the recovery from augmentation, so we recommend going back to working 5 days. The lift part doesn't really add much to it, surprisingly. The incisions are fairly small. There's not really much pain associated with those incisions. It just does not seem to add much to the recovery. Sometimes with the vertical we'll use a drain, but that doesn't really limit the recovery.
So when can someone go back to work after breast lift?
Usually, if it's more follows the breast augmentation, usually around 5 days when I recommend people going back to work.
So what do patients tell you they come in 3 months after surgery?
They're pleased that they've restored their appearance. Because women with a lift usually have been larger breasted to start with. They've lost that, so we've restored what they've lost. And so the enhancement from the breast lift and frequently augmentation just helps restore their self-esteem, make them feel better about themselves.